Okay, then we have finished up to Oakman's ischemic contracture in the video, and now we'll move on to the radius. So, the upper end again. So we have the hyaline cartilage, the capitulum, superior radioulnar joint, the annular ligament. So the annular means annual. So, and we have the hyaline cartilage. So hyaline means something like a flower. So we have a flower like hyacinth. We have the shaft. So this is somewhat like all of the things are like this. So I think reading is much more very interesting, but I used to skip most of them. But to an extent, from pathology and second year, I started reading the entire book. So we have the shaft, we have the anterior oblique line. Oblique means an irregular and oblique surface which never lets light in. The posterior border and the posterior oblique line and the medial or interosseous border. We see the diagram. We have the ulnar, radial and the axillary. So we have the coronoid process, the radial notch, head, neck, anterior oblique line, anterior border, styloid process, the stylus. Stylus is the name of a pen. So we have the process of that, and ulnar notch, and so stylus is the name of a female god also. So styloid process, head. So you must have wondered why these male and female gods are not in the history, but these are the regional names. And every book is not without a prayer. So medial surface, interosseous membrane, anterior surface, tuberosity and tuberosity. Tuber means an opaque surface, an opaque tuber. You would have seen the vegetable tuber of the potatoes, and this turmeric tuber. So, and we have the trochlear notch, the trochlear, the tro and the ciliar. So it's a ciliure. So something like the trochlear. So it means something. Ciliar means it's a bird. So we have the trochlear notch, an ancient bird, maybe resembling an owl. And we have the olecranon process. So nice, isn't it? So it's unfair that we didn't learn Egyptian and we didn't know about the Egyptian birds and the gods. So if we have known it, we would have certainly get past very well. So radius, ulna and the humerus. So it's like we did not have the real of the college. We were just revising about, and we had Thanksgiving also. So that's why people don't worry about it. We'll certainly have our own time. And we have the radius in the ulna on section. So all the surfaces and borders are given. So what is he indicating in the diagram? So anterior border, anterior surface, medial border, lateral border, posterior surface, posterior border, lateral surface. So like he has given different of it and two attached ones. So something like an ossification points, like the right and the left, the radius and the ulna. So we have the posterior surface, the lateral surface, and the lower end. We have the anterior surface, posterior surface. Dorsal tubercle of Lister lies lateral to the oblique groove, and radial artery is palpated against the surface of the anterior surface. It's in the form of a thick, prominent ridge. In lower animals, these thick prominent ridge, how are they, is like somewhat resembling that of the spinal. You would have seen the spinal element, the stone used for jewelry purposes. So something like that will be in the lower animals. So that's why he is indicating that's a thick prominent ridge. So and the medial surface, ulnar notch, the lateral surface, and we have the inferior surface. Bears a triangular area for the scaphoid bone and the medial quadrangular area for the lunate bone. So it has a triangular area and a quadrangular area for the two types of bones. So he is also stating about the different centers of attachment. So these regions in these something like these inferior surfaces are like affordable to malignancies or disformations, because they bear the area for attachment of the bones. So then we have the side determinations, and we have the attachment of the radius. So I'm going quite fast. So we have the biceps brachii, the supinator. So we have the trochlear notch, tuberosities, lateral surface, posterior surface, interosseous membrane, the dorsal tubercle, and the head. So these tubercles are some of the raised surfaces, and which never give attachment to the muscles. But how do they get attached? So in the pathology, it's like against and inwards. So these bones fight, like they grow and grow, and they have a hard outer coating, and these muscles also grow and grow, and they go and attach to itself. So for lunate, the radius and the ulnar, and for the scaphoid, it's in the carpal articular surface. So the right radius and ulna anterior aspect is given a picture. So we have the olecranon, brachialis, head, oblique cord, supinator, biceps brachii, and we have flexor digitorum superficialis, and we have the pronator teres, flexor pollicis longus, and we have the brachioradialis, and we have the styloid process and the capsular ligament, the attachments, and the pronator quadratus, and these pronator. So this pronator is type of an extensor. So this is also a demon. It is also the god, protecting god, you could say. And the flexor digitorum profundus. The profundus is before the fund, and we have the pronator teres and flexor digitorum superficialis, and we have the capsular ligaments. So fundus means it is like a covered head which has no eyes, no ears, no organs, but only the head. So it means the profundus is um, it means something like the head which with some attachments. And we have uh, the digitorum. Flexor is again this demon god. So again we have this digitorum, so digits. And we have the capsular ligament. So the capsular ligament is like which covers the capsule. So somewhat like what I said about the anatomy of the goat. So then we have these attachments and all. So we have the pronator teres. Again, this pronator is the name of a god. So it is a bird, maybe a bird, and brachioradialis is certainly a bird. And we have the radial head of the flexor digitorum superficialis. So flexor is again a demon god. And so digitorum superficialis lies superficial. And we have flexor pollicis longus. So then we have the pronator quadratus. So quadrangular shape of the pronator. And so pronator is about some like these flexor and these somewhat resembles about these mechanical structures or men or the alien gods which are believed to exist in the world in the form of metals and mechanical items which are worshipped, like a bike, a car, an auto, a bus. People who are driving the vehicle certainly worship the vehicle. So something like that. And we have the radial artery as palpated as a radial pulse. And then we have the abductor pollicis. Abduction means towards pull, like towards the gravity, and adduction means against the gravity. So then we have the quadrate ligament. Quadrate is a quadrangular shape. And so then we have the oblique cord. And we have the articular capsule of the wrist joint. And we have the articular disc. And we have extensor retinaculum. Extension retinaculum is a covering, and something like the ligament. So it's about made of this RNA. It's something like resembling the plant structures and molecules. So then we have the interosseous membrane. So interosseous means in between the ossifying centers and the membrane. So this membrane is made of DNA. And so the author is specifying about the plant and the animal variations. And so but to an extent these plants are extinct substances, like they are beyond life. So the beginning of life is from the water and like smaller organs and organisms. These plants and these trees are beyond the life. So after death, the human body turns into wood or a coal which is burnable. So these plants are like the wood. And then we have the ossification and primary and secondary centers. So the clinical anatomy is we have the collis fracture, so 2 centimeter above its lower end. And so remembering about orthopedics, if I remember about orthopedics, I just need to go into my ortho book and then take off the subjects and tell about it. So I'm very much interested about, and it's very very interesting to learn and talk about. So and it's certain that we are going to be dealing with it lifelong. No way then, we are all graduated. So and then we have the Smith's fracture. Then so these Coley and Smith, maybe these are the name of the these are the name of the persons, but to an extent these are the names given to the organisms according to their energy and capability, and we conduct race. So last month we conducted this crocodile race in Vietnam. So we had a good crocodile coming up first. Then we had this tortoise race in Uganda. So and we had nice tortoise coming up, and we also have a lot of race to the organisms, the lower organisms. And last week we had monkey race. So this Monday we had this monkey race in this Afghanistan, I think, a part of Afghanistan, a part of Pakistan actually it is. So there we had this monkey race, and we had, so I distributed the prizes also. And we had me and my so I own a monkey, and so this we both shared the prizes. So I just bought biscuits to him and gave him, and he also had, and sweets also. So then we conduct a lot of animalic competitions, and like to say, and after college, like newly, we also conducted this hair hair this Looney Tunes hair race, the hare and the tortoise race also. And we had the first coming hare, the rabbit, to our department itself, and we had a nice talk with him. And also we had this rat race also. We had this rat race, and this actually this rabbit race was in Buckingham Palace, and this rat race was like in which place actually, in I don't know if I'll refer and say also. And then this rat was made to run in Rotar, and quite cold now, and was made to run in a rotor, and we had nice time with the rat also. And so then we have the congenital absence of the radius. And so again, this congenital absence means most of the congenital absence is made by the disease of the bone only. These muscular diseases are not prolific and never get into these congenital deformities. These bones are the one responsible for proliferation. I mean, we can't say it as a proliferation. Only a few of the cancerous ones are like proliferation and metastasis. These bones have their own congenital diseases, which resembles something of the old age pathology. It means some of the complicated diseases, a disease of two or more, which makes this one. So consider HIV. So if HIV and AIDS, it's an immunodeficiency, and along with tuberculosis and all of the diseases. These bone disorders are like something the previous form. Usually these metastases are the latter form. The previous form, the origin of the disease, which has no other link, but it exists only as a disease, and its cure is not met up to the marketplace, we could say. It's not met up to the recent times. It has a cure, but it has only ancient form of cure. So, and we have the radio ulnar synostosis, the radius in the ulnar. So we have the synostosis. Synostosis means the radius and the ulna are fused together, usually in the proximal 2.5 centimeter of the bone. Pronation and supination is impossible in these cases. So see, he has given the name about the synostosis. He is also given these ancient referent names. So these are the old form of pathology which only exist between if you consider the systems of the organs which are involved, it only involves the gastrointestinal system and the respiratory system. So you could only give the medicines which work only on these two organisms. Other medicines doesn't work on these diseases. So, and we have a sudden powerful jerk of the hand. So, and this is known as the subluxation of the head of the radius, and may dislodge the head of the radius from the grip of the annular ligament. The head can normally be felt in a hollow behind the lateral epicondyle of the humerus. So he is stating something like a bacteriophage. So it is neither a bacteria nor a virus, it is a phage. So it may be virulent, but to an extent it is of the RNA type. So it's very difficult to cure these, but certain regions we have medicines. So then we'll come to the ulnar. We just move on fast from ulnar, and we have the carpal bones, and we have the metacarpal bones, and we have the phalanges, and that's all. So finish fast of the ulnar. So the upper end, so we have the olecranon, the coronoid process, the trochlea, and radial notches. It's not only for the people listening like I'm reading. I'm just reading and getting revised to myself so that I learn it again and again. And certain regions I have not even learned. I learned only the important answers, but it's very interesting also. And so we have the triceps brachii, the olecranon process, we have head of the radius, the anconeus muscle, the common aponeurosis for flexor carpi ulnaris, extensor carpi ulnaris, and flexor digitorum profundus. And we have flexor digitorum profundus, we have extensor pollicis longus, and we have the ulna, extensor indicis, posterior border, medial surface, head of the ulna, styloid process, and we have dorsal tubercle and posterior border, intraosseous border, and extensor pollicis brevis, pronator teres, abductor pollicis longus, and we have the radius, biceps brachii, radial tuberosity, and supinator, head of the radius. So why is that the author gives different names to these, and causes a lot of confusion to us. And we have the supinator brachialis, pronator teres, flexor digitorum superficialis in the anterior view. So all of these, and so we have the all of the same names, we have the vessels and nerves of the forearm. So we have the radial nerve, the deep branch, the superficial branch, and we have the radial artery, median artery. We have the ulnar artery, the ulnar nerve, the brachial artery, the median nerve, and we have the brachialis. So why is that he is mentioning all of it is that these structures of each of the organs and the organisms resemble the same or similar to the region. So if consider if Salem is in the shape of a heart, so the organisms growing in the Salem will also be in the shape of the heart only. They won't be in the shape of an oval or square or rectangle. They'll be only the heart shape. So in that, if Salem has a river, Tirumani Muttar you say, so in that organism also, consider in Salem what we have famous. So you take chicken. Okay, in chicken, like it will be in the shape of a heart. So I mean the anatomy of the chicken, you must have not see about the 3D surface. In 3D surface of the Salem, it will be same as the shape of a chicken only. So then it will be like if Tirumani Muttar river is running, so one of the nerves will be in the same shape of the Tirumani Muttar. So these are the regional attachments towards the gravity and the force of the Mother Earth. So and if you have a hill in Salem region, so the bone of that chicken will also be the same of the hill of the same shape also. In certain regions when we go hunting, we just see the same thing. Because and if we have this fertilizer and we give lot of foods to these growing animals, so these growing organisms have a nice memory of the land, so they grow in the present shape also, some organisms. It's a very amazing thing of the nature. And then we have the shaft. We have the interosseous and the anterior border, the posterior border, and we have the surfaces, anterior surface, medial surface, posterior surface, and we have the lower end. So whenever I am asked question, I used to write anterior, posterior, medial, anterior, posterior, lateral. So most of the things have these anterior, posterior, and the medial. So on the lower end, then we have the side determinations. And okay, then we have the attachments of the ulna. We have the triceps, brachialis, supinator, and all of these. And we have the anconeus also. And we have other attachments. So the clinical anatomy is that we have the dislocation of the elbow, and we have the fracture of the olecranon. So there is a cross union, and we have the made lungs deformity. So it is a mad lung deformity, okay, and it's dorsal subluxation of the lower end of the ulna due to retarded growth of the lower end of the radius. See, the author has noted me also. He has given a E in the middle. So that it's a mad lung deformity. It's usually a French term, and so here, because I am from England, he has stated as made lung deformity, and it's dorsal subluxation of the lower end of the ulna due to retarded growth of the lower end of the radius. So dorsal subluxation means dorsal reduction, but the bone is not lost. The bone is still present, but there is reduction. so the bone is compressed like, without any the compression happens without any disturbance to the surface of the bone, and I mean it's a displacement, and we have the at the low end of the ulna, and that is just because the retarded growth of the radius. So, and ossification of humerus, radius and ulna. So we have law of ossification, and importance of capsular attachments and epiphyseal lines. Okay, then we'll come to the carpal bones. So it's identification: the scaphoid, triquetral, pisiform, the trapezium, the trapezoid, capitate, hamate. Side determinations and general points. And then we have the specific points, and so he's giving different shapes. So again this Egyptian hieroglyph, like he is just has put on the hieroglyphs in the shape of a bone, like whether he has put it up just like that, or after seeing all our 12th standard English papers he has just put it up. I don't know, he must have sawn the papers and only put up. So it's given a lot of pros, and an animal, I mean a human with diabetes would certainly die of reading this. The skeleton of the right hand, and we have all of the small bones, and so this is a picture of this chicken hand, these Rhine clams. So this is a kind of a clam usually, and these are found in China mostly, and and we have the articulations, and we have the retinaculums, the flexor retinaculum. Again comes this RNA. So he has given the green color indicating the RNA, and the crest of the trapezium, and hook of the hamate, and the capitate, and all of that. Then he has given the median and superficial branch of ulnar nerves and the thenar muscles. So branch of to the muscles of thenar eminence. So these look something like the coconut, outside of the coconut, and I mean that the outer straw of the coconut, they say it is a tenganar, so something like that. So there is a thenar, he is given the name as thenar. So again, in childish, when I was a child, I used to talk in a childish language only. If it is tenganar, I'll call it as thenar only. So opponents policies and opponents digitae minime. So the author Cunningham is very confident about me, that, and he likes me very much, so that all of whatever so he has created a nice anatomy with all of my childish words, and So the clinical anatomy is that the fracture of the scaphoid, and we have the opponens pollicis and the opponens digiti minimi. So these opponens is also a demon. So digiti minimi means the demon with digits of hand which are lesser than the usual. And to the clinical anatomy, we have the fracture of the scaphoid. So scaphoid is in the lower part, and if scaphoid there's a fracture of the scaphoid, what happens? There is tenderness and swelling in the anatomical snuff box and pain on longitudinal percussion of the thumb and the index finger. So this residual disability is more marked in the mid-carpal joint than in the wrist joint. The importance lies in the liability to non-union and avascular necrosis of the body of the bone. So he's given a lot of informations. And then we have the carpal tunnel syndrome. Dislocation of the lunate may be produced by the fall on acutely dorsiflexed hand with forearm flexed. Okay, then we have the morphology of the calf also. The proximal row consists of os radiale, os intermedium, os ulnare. So he has given the homologous parts of primitive tetrapoid and human carpus. Okay, then we have the metacarpal bones, and it's going to finish off. So like in anatomy, when we read about some 10 pages, we could read loud and memorize and all. Again the next pages will again turn to the first 10 pages and never come back. So this is the comedy in anatomy. So never reach the top. It is like something like a drum in the hell. So the metacarpal bones. So he has given the differences, and we have the characteristics of individual metacarpal bones. So, and ossification and union also he has given. Likewise, appearance and fusion and all, is that necessary? Like I don't know, maybe maybe like a small organism which grows to a larger organism. These small appearances and fusion points are very much important. So this hand of a chicken may turn widely into maybe a camel with different ribs, a pork with different layers of fat, or beef with different muscular attachments. So we must be very careful in learning all of these in this veterinary anatomy. So it's very much useful for all of the persons. So then we have the main attachments. We have opponens pollicis, abductor pollicis, palma interosseous, flexor carpi radialis, extensor carpi radialis longus, oblique head of the adductor pollicis, flexor carpi radialis, and the extensor carpi radialis, oblique head of the adductor pollicis, transverse head of the adductor pollicis, the extensor carpi, and opponens digiti minimi. So and we have the palmar interossei picture and the dorsal interossei picture. Interossei means in between the ossification centers. Ossification centers may be in few mammals. Interossei means in between the ossified parts of the bone. So these bones doesn't have more growths. They are stable. And we have the metacarpal of the right thumb showing muscle attachments and its palmar aspect. So we have the sesamoid bones are there. So the in between bones, like so we have the articulations of the bases, and we have the transverse head and the oblique head. Clinical anatomy is there. So we have the clinical anatomy. Tubercular or syphilitic disease of the metacarpals and phalanges are there, and fracture and we have different things. So we have next, we'll come to the phalanges. We have the base, shaft, the head, and attachments is the base of the distal phalanx and the middle phalanx, the proximal phalanx, and so different attachments are given. And we have these cruciate fibers of fibrous sheath. So, and we have already learned about it, and we have the deep transverse metacarpal ligaments, and we have transverse fibers of the fibrous sheath, and we have capsules also. So we have the dorsal digital expansion of the middle finger. So we have something like a tree shaped. So we have, see, like what I mentioned about, and so next we have the sesamoid bones of the upper limb. So we have the pisiform, two sesamoid bones, in the palmar and in the first metacarpal bone, and one sesamoid bone, the interphalangeal joint of the thumb, and all of these stories. And we have additional reading. That's all. We finished up with the second chapter. Next we have the pectoral region. So we had this 10 mark also, like about the breast and the mammary glands. I mean this superficial fascia, and we had this clavipectoral fascia also, and the serratus anterior muscle about. So thank you.